The biggest sporting spectacle of the year runs the risk of becoming a COVID-19 super spreader event. Following months of uncertainty and unprecedented opposition, the Olympic Games kick off in less than 30 days from now. There are tough measures to keep the virus at bay that have also been criticized as being too harsh. Joining us is the man who has been at the center of dealing with it all, Mr. Tatsuo Ogura, Director, International Communications, Tokyo Organizing Committee of the Olympic and Paralympic Games. Welcome to WION.
Thank you for this opportunity.
Mr. Ogura, I'm sure it's been a hectic few weeks for you with less than a month now to go for the Games. They are kicking off under the most complex circumstances. Two members of the Ugandan delegation have tested positive for COVID-19 after arriving in Japan. What happens if the number of cases goes up? Will there be even tougher measures in place? Are you absolutely confident that the Games pose no risk to the Japanese people?
Thank you. So we are now less than 1 month to go to Olympic Games. And we are in the last stretch, the final stretch for preparation to host the Olympic Games in Tokyo. It's really important to ensure safe and security for everyone participating in Tokyo 2020 Games. So a key part of the Games plan to ensure all Olympic and Paralympic Games participants and also people of Japan stay safe and healthy this summer are playbooks, which we published first edition back in February this year, and also updated twice in May and this month, June as well. So working together with IOC, IPC, and medical experts, and those who are working together extensively, working in the all-partner task force. So this playbook shows how we make the countermeasures to COVID-19. And we have different dedicated playbooks for each stakeholder to participate in the Tokyo 2020 Games. So, the situation currently in Tokyo's number of COVID-19 cases are decreasing. And the government of Japan lifted the state of emergency. And now we are, as a society, trying to keep the number of the cases lower as much as possible.
Right.
Also, the vaccination the case of the vaccination in Japan are increasing.
But the Games are going ahead despite unprecedented dissent. Around 430,000 people have signed an online petition calling for a cancellation. It says, cancel the Tokyo Olympics to protect our lives. In May this year, the Asahi Shimbun newspaper said 83% of Japanese people backed postponement or cancellation. A poll by the Kyodo News Agency found 86% of respondents believe the Games would spread the virus. 10,000 registered volunteers have quit. Hundreds of cities have backed out of hosting athletes. Are the concerns of thousands of these people not valid? Why hold the Games despite such strong opposition?
So we believe that the power of sport to change the world and our future, which is our Games vision. And actually the number of those who opposition to holding the Games are getting lower in other poll by Yomiuri Shimbun, which was published early this month. That shows that the ratio of opposition and agree to hosting the Games are 50-50. So, when there are more cases, COVID-19 cases increasing in Japan earlier this year, the opposition voice has been increasing
with the games going ahead, the people have given up opposing the idea that the games are being organized. These polls that you're citing, the numbers are still significantly high.
Almost all the games getting the criticism before the games are opening. And this time, we are in like unprecedented situation. We postponed the games first time in history. And we have been working on this countermeasures on COVID-19 with many stakeholders. We are encouraged to see the growing number of vaccinations being administrated throughout the world and gradual return to normal life in many countries. Even though the vaccinations are not prerequisite for participation in the games, and Tokyo 2020 has worked hard to prepare for the games that will be safe and secure for all regardless of vaccination status. Athletes and participants are nonetheless encouraged to get vaccinated if the option is available to them, as this is one more tool that will help ensure and safest possible environment for games participants and also residents of Japan. As announced by IOC, as many as 70% of the residents of the Olympic and Paralympic village are already vaccinated and or have secured the option to get vaccinated. And we have a good reason to believe the figure will be well over 80% by the time of the game starts. So we place the highest priority on safety for the sake of all participants, including the Japanese public, who will playing host to the games.
Right, but just over 6% of Japan's population is fully vaccinated. So will there be a rethink on the decision to allow local fans at the stadium? 10,000 domestic fans will be allowed. This also goes against the recommendation of the country's top medical advisor, who has said that the safest way to hold the games would be without fans.
So last week we had a conversation with the medical experts. There have been a number of those roundtable with medical experts, and last week we received that proposal from Mr. Shigeru Omi, and even though he mentioned that the risk of the pandemic could be lowered by hosting the games without spectators, but also he advised that how we lower the risk even with spectators. So we have been discussing with those medical experts, and we are listening to those medical experts' advice. And based on the advice, and we have been working on how we can host the game with the spectators upper limit of 50% of the capacity of the venues, or upper limit of 10,000 of the each events.
Right. Now, the 3-day quarantine rule for athletes from countries including India means that the players would be losing out on crucial training time. Are there some conditions under which this rule could be revised, perhaps allowing them access to the training centers?
So we have discussed with the government of Japan about the situation for the games participants coming from the India and other countries heavily affected by variant strains of the coronavirus, as is currently the case with all arrivals from those countries. Games participants coming from them will need to follow more stringent procedures and participants coming from other countries. These current restrictions applying to all arrivals are also stricter than general procedures for participants outlined in the playbooks. While current border controls stipulates that all visitors from the India and those other countries must quarantine for 10 days, Games participants from those countries will be asked to minimize physical interaction for 7 days with others and stay with contact from other teams for 3 days. For a total of 10 days in restricted bubbles, they will be required to screen every day. This screening and minimization of contact with others, in addition to other measures outlined in the playbooks, we will reduce the risk of infection and help us deliver safe and secure games for all participants and Japanese people. We will not be able to train at all for the first days of their stay in Japan is not the case. We will make sure that based on their activity plan and those countermeasures, as I mentioned, they will have opportunity to train in the on the ground. So that's the case.
All right, let me ask you about the worst case scenario. The Olympic Games do face the risk of becoming a COVID-19 super spreader event. If things go south during or after the event and the virus spreads, leading to loss of life, who would be held accountable?
We are repeating this. This is a key part of the game to ensure that we have to keep the participants and the people of Japan stay safe and healthy, which is really the most important thing. On top of the showing the value of Olympic and Paralympic Games. That's why we are putting all together into the playbooks for each stakeholder. We are making sure that we ask all the delegation from the for the participants to the games to assign COVID-19 liaison officer, so that they are in charge of collecting all the information for first 14 days of activity plan for all the delegation member from their delegation, so that we know as Tokyo 2020 Organizing Committee, all the participants, activity plan in Japan, and it's shared with the government of Japan to make sure how we can be sure that there will be less or no contact with local citizens, as well as we have to protect the safe environment for athletes. So we ask as many staff members and participants possible around close contact to the athletes get vaccinated as well. There's a plan that the location of participants monitored by GPS are not monitoring all the time, but when those participants are going somewhere that not written in the activity plan submitted before their arrival, that GPS can be used to make sure if they are moving based on their activity plan. So with those countermeasures, everything written in the playbooks. We are making sure to make the safe and secure manner environment during the games time.
Right, Mr. Ogura, all those entering Japan for the Olympics must agree to have their location monitored by GPS. They have to download several applications and keep the organizers informed of their whereabouts. Isn't this kind of surveillance a bit too much?
So as I said, this GPS is not for monitoring all the activities the participants doing, but just used for when when the organizer needs to make sure whereabouts of the participants, and if there are difference from the pre-submitted activity plan, we make sure with this GPS monitoring system. So that's the case of this use of the GPS.
Mr. Ogura, to what extent are you concerned about the protests and the dissent, even the apprehensions expressed by the medical community overshadowing the games?
We have been working on securing the medical people for the games. We understand that it's really important to keep the society works. Of course, the Olympic and Paralympic Games is not only thing happening in Japan and the world. We totally understand, it's just a part of the society. So we have to make sure that we can maintain the medical situation for all the general public during the games time. So we have been working with those medical community, and also we have been trying to reduce the number of medical staff, medical people committing on the games, and we projected, we reduce 30% of these medical resources, and we already secured 90% of those reduced number of the medical, like doctors serving for the games. And also those 10%, we need to make sure we have to secure for the games. We have been working closely with Japan Sports Association. There are a number of sports doctors who has been registered to work on the games through Japan Sports Associations. So we have been working with them to matching with those sports doctors to make sure we have enough medical resources for the games, and also maintain the medical resources for general public.
Mr. Ogura, we are leaving it there for the moment. Crucial month ahead for you. Thanks very much for speaking with us here on WION World is One. All the very best.
Thank you very much.